You're all here with us today. This is a really important topic, a really beneficial one. I appreciate you all making time to come and see us today. As people kind of keep trickling in, we are just going to get us started to keep us on time. So, welcome to Boosting Childhood Immunizations Practical Strategies for Effectively Engaging Schools and Families. Um, Before we delve into the webinar content, I just wanted to go through some housekeeping reminders. Um, all attendees are in listen only mode, which means that you can hear us, but we can't hear you. The chat function is also disabled if you noticed. If you have any questions or you kind of want to respond to something, please use that Q&A button at the bottom of the screen. We will have a designated time period at the end for questions, but feel free as the presentation is going on to ask those as you see them. And that should be at the bottom of your Zoom control panel. Additionally, on the bottom of that panel should be, if you want to turn on closed captions, there might be a button that either says closed captions or CC, depending on your version of Zoom. And finally, we do ask that you can complete all evaluation poll questions we have at the end of the presentation. These are really helpful for both our funder and for us as we determine what makes sense to deliver in the field, what are kind of like the pulse points of what everyone's talking about, and how can we make this content better. So then I just want to say I'm Donnie Greco. I'm an associate here at the National School-Based Health Alliance, and you're probably familiar with us, but if you aren't, we are a national nonprofit that advances the work of school-based health centers, and we do this by offering technical assistance, convening the field for networking, and supporting quality improvement initiatives. Today's webinar is part of our NTAP, or National Training and Technical Assistance Partner Work, where we received funding from the Health Resources and Service Administration to support the work of health centers, particularly as it relates to school-age children. Today, we are talking about immunization, but we've also done a bunch of other webinars on topics like integrated mental health, vision services, and we even had one recently on healthy sleep. I do encourage you to go check that out. It's on our website under our e-library. So I already kind of gave a little bit about who I am, but I'm going to now pass it over to our two fabulous presenters today. The first being Danielle from the School-Based Health Alliance, and then she can pass it over to Deanna. Danielle?
Thank you, Donnie. And so good for you all to be with us this afternoon or this morning, wherever you're joining us from. But again, I am Danielle Dobbins, director here at the School-Based Health Alliance, and really excited to be working in this space and supporting all of you with our training and technical assistance work. So I will turn it over to Deanna.
Hi, everyone. It's so great to be here with you all. I've Deanna Bruce. I'm the CEO and founder of Deanna Bruce and Associates. It's a consulting firm based in Washington, D.C., but I support schools and nonprofits across the country and spent a lot of time opening school-based health centers in the D.C. public schools. And it's so good to be back in community with you.
All right. Thank you both so much. And I just want to give another shout out, everyone. Deanna is amazing in her field. Lots of great things, lots of presentations. So please use this time to think through the content, ask any questions you have, because this is going to be a good one. And before we pass it off to the content, I do just want to kind of center us with the learning objectives for today. After this presentation, we really hope that you'll be able to identify strategies health centers can use to increase childhood immunization delivery for school-age children. And also describe one approach for integrating family-centered care coordination into health center workflows to improve immunization access for school-aged children. So with that, I'm going to pass it over to Danielle, who will give us some background on immunizations, and then she'll pass it off to Deanna. Right, so let me just go to the next slide. Danielle, take it away.
Thanks, Donnie. So let's start by really grounding ourselves in the role schools play in student health. Schools are really more than just places for academic learning. They are really critical environments for delivering health as well as wellness services. And they really create systems that help students stay healthy, feel safe, and engage in learning. And so schools do this through multiple models, really, whether that's the school health services or whether it's in partnership with school-based health centers or health centers. So many of you help build those intersecting systems of care that really help to meet students where they are every day. Next slide, please. So alongside schools and our education partners, families are also essential partners in student health. They really help to reinforce those healthy behaviors at home. They communicate with providers, and they also help to ensure children stay up to date on preventive care, especially immunizations. But just as important, families help us also understand the barriers that they face, whether that's access, just access to information or even trust. So throughout today's session, I really want us to keep in mind improving immunization rates isn't just a clinical issue or come from it from a clinical perspective. It's really partnership and in partnership with families. Next slide. So reliable immunization services really do three key things that we can focus on now. They really help to protect students from serious illness while also helping to reduce absenteeism by keeping students healthy and in school. And they can also help to limit the spread of disease across the entire school community. So when we talk about immunizations, we're not just talking about individual health, we're talking about keeping classrooms open, students learning, and really about keeping communities safe. Next slide. So a quick reminder on why immunization schedules matter. These schedules really help to provide like the recommended timing and dosing to ensure children are protected at the right stages of development. So they're not static, they're based off of evolving rather public health priorities. And so in practice, we know that there's also nuances, whether that be clinical decision making, may vary depending on the patient's needs, whether that be risk factors or just other things that may impact. Next slide. So for many of you supporting implementation, here are some resources we just wanted to highlight, and certainly more to come later on in our presentation as far as list of resources. But here, the CDC schedule and the AAP guidance are foundational tools for you all to use. And at the same time, it's also important to follow your local and state requirements, which may also shape how these recommendations are applied where you are. So consistency across your team, using trusted sources, these are all critical for building confidence with your families. So next slide, please. So this is where we start moving into action. Health centers, you play a critical role in helping to close that immunization gap. So what does this really look like? Whether that's building those referral systems with schools, using data to identify those students who are missing vaccines. That's a big one. Or making every visit an opportunity to check immunization status. It also means reducing barriers, whether that's offering on-site or school-linked immunizations, and then really identifying your champions within schools. And I'm sure we'll get into more of that a little bit later on in the presentation. But at the core, this work is really about access, integration, and trust. Next slide. All right. So when it comes to engaging your families, we start with what matters most. And for many families, that's really safety. Safety is a top concern. So our role is to really acknowledge questions directly, not avoid them, to provide clear and evidence-based information. So again, consistency is key. So when families are hearing the same message across providers and staff, it really helps to, again, build their confidence and trust. Next slide. One effective approach many of you are already using is motivational interviewing. And so this really means asking open-ended questions, actively listening, and then affirming those concerns that you hear. It's not about persuading, it's really about supporting families and making informed decisions without judgment. So that approach is really key in terms of building long-term relationships and improving the uptick over time. So I will now turn it over to our guest presenter to share more about what these strategies have looked like in practice. Yana?
Yeah, thanks, Danielle. So as I mentioned earlier, I served as Director of Health and Wellness for the DC Public Schools for a little bit more than a decade and have since supported all of DC's charter schools on childhood immunization response. So there's been a concerted effort in DC, and I'm going to talk about that in more detail, to increase vaccination rates among our child age, school age students. But I bring more than 25 years of work at that intersection of what I call health and education policy and programming. In my current capacity as a consultant, I provide a lot of strategic planning and stakeholder engagement, policy development and implementation, i.e., childhood immunization uptakes, and a lot of coaching and training for schools. I've provided a lot of support before handling any communicable disease outbreaks for the school district and things like that. So when it came to doing this work that we're going to talk about today, I jumped into the deep end and ran with, grabbed the hands of the schools, of our charter schools in town, and we just kept rolling to try to engage our families and increase our rates. So in addition to that, I'm a board member, a yoga teacher, and the proud parent of two adults, one who's graduating with her master's in public health next week. That's awesome. And I can't believe that I have a child with a master's degree. So we'll just keep going. That's a different training, or maybe that's a support group. Let's keep going for the next slide, please. So why do I do this work? Well, I really believe, and Danielle talked about it earlier, like our job is to ensure that every student learns. Like as educators and people who work in schools, like we're working in schools because that's a public health intervention, but also we work in schools because we believe that it's our job to ensure that every student learns. And we all know, all of us on this call know that in order to learn, our students must thrive. And that's the public health intervention that we're providing with the school-based health center, with even just an immunization program. All of that is the public health intervention that helps students come to school and perform academically and stay healthy. So next slides, please. And so if we were all together, I would throw this out. Why do you do this work? Feel free to think about it yourself, jot it on a piece of paper, or answer it in the Q&A, however you feel comfortable. I'm going to throw out a bunch of big questions. Some of them you're going to see repeated in our mentee opportunities later on. So go ahead and go on to the next slide, please. And so when I ask you why you do this work, it's because I want you to center yourself in your intention. Why are we here? Why are we doing this work? Why do we care so much about immunization programs in schools? And sort of what's your role in this? Later on, we're going to see a laundry list of roles in schools, and each one of those plays a part. And so, why do you do this work, and what is your role in helping families make the decisions around immunizations for their students so that they can come to school and be healthy? Next slide, please. So another big question is, what do you remember about immunizations as a child? And since I have the mic, I will tell you that I remember getting a lollipop after getting a shot. That's a big memory that I took away from getting immunizations. My pediatrician would hand me a lollipop. He'd leave the room. I'd open up his desk drawer and I would swap it for one of the root beer ones. Remember the Dum Dum lollipops? So that was it. I got a shot, and then I got a root beer lollipop at the end. We all have these memories. I'm sort of solidly Gen X, and if you think about older Gen X folks, they start telling me about, well, I remember I went to school and they would line us up and give us a smallpox vaccine. And so that leads us into the next slide, which really is about the role of schools historically when it comes to immunizations. So, I hear from schools like our job is to teach kids. Our job isn't immunizations. Well, actually, it's been a school responsibility and a school role. First, it was a school role, then it became a responsibility since the 1800s. So first, Massachusetts started requiring the smallpox vaccine in the 1850s. Then fast forward, many people who are still alive remember when the polio vaccine started being done in schools. My mom told me stories about having to lay on the couch and rest before there was a polio vaccine. My grandmother wouldn't let her run around too much because I guess playing with other kids was the risk of developing polio. She also wasn't allowed to go to the swimming pool. And then suddenly she told me she got vaccinated for polio and her life changed. The quality of life changed. She was able to run around like a child, swim in the swimming pools in the neighborhood swimming pools, and and it just really improved her ability to engage in her society. And we saw that was sort of one of the first times we saw wide scale vaccinations in schools. Fast forward, we had smallpox in the 60s where there was mass vaccinations in schools. And in the 1970s, the US first established a goal of having 90% of children fully vaccinated. And after that goal, you started seeing states pass laws requiring immunizations, a set of immunizations for schools. And in 1979, that was when DC, the District of Columbia, passed a law requiring that all schools collect immunization documentation. I think that's important because the responsibility it's with the families, but it's also with the schools. The schools are responsible for collecting immunization documentation from students and to exclude those that are not up to date. And when you are working with a school, being able to understand what their requirement is will help you get in the door more easily to support them in that. Because here in DC, it requires all schools to collect immunization documentation. So now that's an institutional requirement of the school district. And so if you want to work with a school and help them provide immunizations to their students, if you can fit within their institutional requirement, that helps you when it comes to FERPA. We all know that FERPA is like HIPAA in many ways. It's different. It's actually even more conservative than HIPAA, but it is the privacy law for schools. And if you are serving as a school agent, providing an institutional requirement of the school, then they can pull you into their FERPA umbrella and you can more seamlessly engage with families and students around immunizations. Certainly, we have a federal law that says families need to consent to immunization, so you also have to contend with that. But it definitely makes data sharing a lot easier when you are serving as a school agent for a school that has an institutional requirement. And SBHA has the sample data sharing agreement that I wrote with DC Public Schools and DC Health and Medicaid many years ago. You all have it somewhere in your files. There's the model policy, that the MOU that we drafted. And then a year after DC passed this, then finally every state in the country had a law requiring immunizations for schools. And on the right, we've got a cutie getting a vaccine by a school nurse. So keep going, please. And so Danielle covered a lot of this, and I like the way she talked about it's nice and neat, and it's very sort of public health focused. When I work with schools, I break it down and try to be as direct as possible. So the first one is you have to. Because, like I said, every state passed a law by 1980. So it's the law, and you have to follow the law. And there are lots of school laws, and it's hard to follow them all, but you have to. And so that's the law, right? So that's the first reason why a school is focused on immunizations. Second, a school will focus on immunizations because it protects staff and students from disease that can hurt them and others. So then they start getting on board with you from the public health perspective that like this is a good idea because it protects our students and our staff members from diseases that can hurt them and harm others. And then you get to the piece that's really super compelling for schools. And that is that unimmunized individuals exposed to, say, measles have to be quarantined at home for 21 to 28 days. We're talking, 3 to 4 weeks. You're just out of school. Now, if you're exposed and you get vaccinated in that moment, once you've been exposed, then the public health department of whatever state you're in will work with you on a way to get back sooner. But you're missing up to 3 to 4 weeks of school, work, childcare, all public activities. It's a complete disruption. And that really motivates schools. all the school staff members were having holiday parties, and then suddenly they couldn't actually make it to winter break. Several of the schools in DC just had to go virtual. Like they didn't even have enough staff. Everyone had gotten sick at all the holiday parties, and then they couldn't run school. There weren't any staff there because we're stuck at home. So that's not only are students not there from an attendance perspective, but from an operations perspective, the operation of school starts to break down as more and more people become exposed and have to isolate at home. So or have to quarantine because they've been exposed. So these are sort of like in order the way that I experience schools prioritizing this work. Keep going. And then we talked about, Danielle already covered this, so we don't have to spend a lot of time on it. But these are some of those outcomes that schools can benefit from when they follow their policy. So their policy is an articulation of the law in their state. And so when they follow the policy, they can predict to experience these benefits. Let's keep going. And you'll have these slides. And I think that what's really important is some of this language is language that I'm giving you that you can use when you are engaging with the schools that you collaborate with. And so this consequence is sort of another way. So, the last slide was about the positive impact, and this is sort of the negative consequence of not following your immunization policy that you have in your school, in your county, in your state. So we remain unprotected, where we get below herd immunity. And when I talk with schools, I talk to them about, once you're below herd immunity, that means that you're at greater risk of outbreaks. And those outbreaks mean that kids get sick, that staff get sick, and that school operations and attendance start to break down. And then also at the bottom, it's important to think about the state enforcement actions. The last thing any school wants is for the state to get involved. Anyone who's worked with the school knows that protecting the autonomy of the school and of the school district is really important to them. And so when they don't follow the policy, then their state health department gets more interested in them. Their state education agency gets more interested in them. So if you want autonomy, follow the policy that you have. Keep going. So this is a big question when I work with schools. I ask them, what keeps you up at night when you think about childhood immunizations in your community? And I really would love it if you could throw that into the Q&A, because I think that is insightful to see what keeps us all up at night when we think about childhood immunizations in our own communities. But keep going. We'll review those as they come in. So, okay, so here's the big case study. Go ahead, keep going. Um, and this is the crux of the problem was what were the barriers that school students, families face in meeting childhood immunization requirements. We've had a law since 1979. It's pretty darn clear. People didn't go to the doctor as much as he was thinking about we weren't, in the back of our heads, we were like, oh, what about childhood immunizations? So, what are some of those barriers to get us back on track where we need to go? Keep going. So this was the problem that we faced in DC. Immunization rates fell sharply. Schools were vulnerable to school operation disruptions caused by outbreaks. In DC, which is unique to some other areas, we enroll students in school first, and then we give them 20 school days after the start of school to submit their immunization records. So that's different. Some school districts, some states do it differently, where you don't get to enroll in school until your vaccine records have been provided. And I'll tell you one reason that why it might be different in DC. Our law requires students to be up to date on their vaccinations every single year because it's really tied to enrollment. So in DC, you enroll in school every year, where a lot of states you enroll in school when you start pre-K, when you go to middle school, when you go to high school. And as long as you don't change schools, those are the 3 times you enroll in school. Maybe you enroll in school if you move around, you'll have to enroll in school. And at each of those enrollment periods is when you provide immunizations. So you're only providing proof of your immunizations three or more times in your entire K-12 experience. Not the case in DC. You enroll in school each and every year, and each and every year you have to prove your immunizations. So that's a lot of students that are impacted each and every year. It's a lot of work for pediatricians to keep up with, and it becomes a little overwhelming for schools to manage. And it's also important to know that half of DC's schools are in our public charter schools. So for us to protect our entire community, we needed to have a differentiated approach for our charter schools that was going to be different than the traditional DC public schools school district. Keep going, please. So the solution was not only to have the law, that was what we basically had, but to articulate it into a policy. So we have a policy. If you want to read all 40 pages, you're welcome to. And then we put together the state education agency developed the policy very clear. Everything is in there. Like literally everything you need to know is in there. And I could probably even tell you, I know that like religious exemptions are on page 18. Like, you get to know the policy as you're navigating it. We also, the state education agency, created multiple one pagers. So you don't have to look through there to figure out what are the data systems you need to know about. What do how do you get people caught up? Like those kinds of things. There were one pagers for that. What are the key grades? Things like that. So the 42 pages was there. There were one pagers, and then there were people you could ask. And I was one of those people you could ask. We also worked with the city to prioritize four key grades. So trying to replicate what other states were doing. Even though students are enrolling in school every single year, let's require immunization documentation at the pre-K 3. We have universal pre-K in DC. So at the pre-K 3 level, once, show us your immunizations. It's generally around, that's the first time you're in. We want to see all the shots you've had. Once you get to kindergarten, that's another key grade. That's about a year after your 4-year-old requirements. That's when there's another big chunk of vaccines that kids tend to get right after they're in kindergarten. And then seventh grade, that captures vaccines that you may have gotten in fifth and sixth grade. So you've got your Tdap, your meningococcal, and your HPV are there at that sort of approaching middle school. So by seventh grade, we're looking to see if you already have them. And then at 11th grade is the last key group. And that's where we're looking for that meningococcal booster and your second HPV. By that time, you will have received your second HPV vaccine. So those are the four grades that we prioritized. We provided a ton more resources. Like I mentioned, those one pagers, there's a whole website dedicated to information. If you need something, it's there, and more coordination. So I was hired by the Charter School Board in DC, which is the authorizing organization. Then there was DC Public Schools, there was DC Department of Health, and there was the State Education Agency, the Office of the State Superintendent for Education. So even though DC is not a state, we have a lot of state functions. So we have a lot of our city agencies that serve in state function capacity. So you know who you are. If you serve in a state capacity in your state, like we have those kinds of offices here in DC that serve in that capacity, even though we're not a state. Anyway, that's a little bit of government less. That's your government lesson for the day. A lot more communication. And Danielle talked a little bit about how you engage families. We really pressed upon our schools that sort of this was my signature sauce of families need persistent, consistent, and creative communication. Uh, Persistent means you continue to engage them. You don't let go. You continue, there is a barrier that if they're not talking to you, there's a barrier that they're not sharing with you. It could be they can't get an appointment. It could be they have questions about the vaccine. It could be they want to space them out differently. There could be a number of reasons, and they're not just ignoring you because they don't want to talk to you. Well, maybe they don't want to talk to you, but they really, there's a barrier. And so if you are persistent, you can hopefully build their trust to be able to understand what the barrier is and then either help them navigate around it or provide them with the resources so they can get their questions answered. Consistent, don't move their cheese, don't move the ball. If you start the school year with certain policies, keep them the whole school year. Families don't like it when you change the rules on them. Schools don't like it when health departments change the rules midstream because then trust gets broken immediately. And creative. Families are super, super busy, especially the ones that wait until the deadline. They are very busy. They prioritize based on what's right in front of them. They have more barriers than others might have. And so that creativity and friendliness and warmth is going to really sort of make it happen. Dedicated data tracking tools, that was a huge thing that the health department did. They changed, they used to give schools access to the immunization registry, and it was so confusing because they're school staff. And so they created a separate thing in Salesforce that was like, here, log in here, look here. These are the students that are out of compliance. These are the students in those key grades. This is your exclusion list. This is, and then you look at your exclusion list and you can say, okay, well, these kids are McKinney-Vento, so they don't get excluded. These kids here, oh, I know they have an appointment. But, they sort of helped schools focus in on a list of students. So it wasn't overwhelming to them. It was still a lot of work, but it wasn't overwhelming. And then, like I said, the charter school board hired two consultants. Sharon Bostic and I were hired and to help them on their charters for the charter schools to implement the school immunization policy. And it really comes down to relationships and data management. And I'm sure each and every one of you would agree with that, that the data management's you got to be real good on that, but it is all about relationships, relationships with the schools, relationships with the families, and relationships with their providers. Keep going, please. And so, ta-da, here's our successes. Super proud of this. It's a little blurry. I am sorry. So what we started out with at the beginning 3 years ago in August of 2023 was when we said, all right, we are all going to hold hands and we're going to work very hard and we're going to get the rates up. So of those, these are just of the key grades, the pre-K 3, kindergarten, 7th and 11th grade. We started the school year at 58% immunization compliance for all of our required immunizations in DC in August of 2023. And I'm going to explain why this looks like a zigzag. Health departments and schools work together and they change over from one school year to the next on a certain day. Here we do it it's sometime like middle of July. And so you go from a high rate to a low rate when you go from one day to the next. Once you start the new school year, you've got all the new kids in who have been enrolled but have not provided immunizations yet. So we started really low and then we went high, we went a little below, we went a little high. So we started at 58% in August of 2023. And by March of 2024, it's not the end of the school year, but it's pretty much pencils down on immunizations. We get everyone in, everyone who's gotten an exemption because of their appointment cards and things like that. So we got to like 85% in that first school year, which was huge. But we didn't see a whole lot of movement in all grades that school year. Last school year, September 2024, we started the school year at 74%. So already the work that our schools were doing, not only with the exclusion grade students, but with the kids that were coming into an exclusion grade, helped us start the year in a better position overall. And I think that's really important that families are cluing in like, no, we really mean it. We really are going to exclude you this year. I know it's been a while, but it's really going to happen. And they start taking action before the school year starts. So we started higher at 74% and we ended at 96%. That is absolutely fantastic. We went down a little bit, but again, see, we're starting the school year. So in September 2025, we started the school year at 83%. Huge increase. Like we're starting the school year at the same way we ended the school year 2 years before. And then we've ended the school year at 97. It's now up to about 98%. That's for all vaccines in those four key grades. And we also are seeing that our overall rate has increased significantly. Not at to the 97, 98%, but still significantly higher. It's in the 80s for all students. So it'll take us a few more years to cover every grade. But I think that it's important, and what we all are also are seeing is that there's an increase in religious exemptions. And so you can take this 97, 98% and subtract about 5% to get to an actual vaccination rate. So this is compliance rate. So this is awesome. 97, 98% of our students are compliant with immunization requirements. You can get a religious exemption if you need to in DC. And so with an increase that we've seen in religious exemptions, we sort of shave off about 5% off that top number to get to an actual vaccination rate. So that's the percentage of students that are actually vaccinated uh, against all of the communicable diseases that we require in DC. Keep going, please. And so, yeah, I mean, this is some of the overall stuff. Vast majority of students got up to date. Few students were required to be excluded. And I think this is important because when you work with schools on school exclusion at a time when we're seeing significant attendance issues across the country, it is hard to get schools to really believe that they can do the work before the exclusion day. They are very worried about excluding students from school, and that's where they land on we don't want to exclude students from school. We already have an attendance problem. And what we were able to show them was if you do work between when school starts and when the exclusion day happens, you can do it with excluding very few students. And among those few students that actually ended up getting excluded, it only took about 2 to 4 days for them to get their vaccines and get back into school. So we saw it was a huge success. There wasn't a lot of chasing kids after the exclusion date to find them. They got vaccinated, they got back to school. If some students did not show up, that's when you do your home visits and you go find those kids. And that's where you're doing the troubleshooting around the barriers with the family there and help them get their child vaccinated and back into the school building. And big thing is that the families were engaged and they knew that their school cared about them. And that the schools told us over and over. And they really deepened their relationships with their families because the families understood that, yes, Deanna's going to call you every week, but Deanna's also got your back. And she's not going to let go. And she's going to help you sort through what the issue is. Um, you know, it's individual, right? Mom can get incarcerated. We had a parent get incarcerated right before the appointment. Okay, well now we have to figure out another way for the child to get vaccinated or get now once your parent is incarcerated, you actually qualify for McKinney-Vento. So then the child didn't have to be excluded because our homeless students don't have to be excluded. So but it's again, if you're willing to do that individualized work with families, you can see tremendous success when it comes to immunizations. Keep going, please. And I know we want to wrap up a little bit about how much longer, how long do you want me to keep going until we stop and go to the Q&A?
Um, Probably like maybe just like 5 minutes. Keep
Okay,
going.
great. Okay. So this is some of the lessons learned of what worked, right? There was immense investment at the authorizing agency for the school board, at the state education agency. They had staff, they had a website, they had resources, they had their own trainings. With us as consultants, we provided, I think it's on another slide, there were three key things that we provided as individual consultants to the schools. So Sharon and I split the list of schools. I had half of the charter schools, she had the other half. We engaged them and did a one-on-one phone call at the beginning of the school year, a 30-minute call with each school just to talk through policy hasn't changed. Here are the updated dates. Can you get into the data systems? Here, share your screen. Let me see you get into the data system because sometimes people are like, "Oh yeah, I can get into it." And then they're like, "Oh no, I can't." So, well, let's figure out right now whether you can get into it and if not, let's escalate and make sure that you get access quickly. And then we followed up with on-demand technical assistance. You could call, you could text us, you could email us, and we provided monthly emails to them with updates, with information about their own immunization rates, asking them what their plan was to close the gap before the exclusion date. And then we had a monthly community of practice in the fall from September to December, where, because that's really our big time. December is our exclusion date. So, September, October, November, December, we had a community of practice each month where we talk through how are you implementing the policy? What are the barriers that you're finding with families? How are folks resolving those barriers? So, really was a great way to bring people together. Because if you're focused on immunizations in a school, you're probably isolated. You're probably the only one doing it. Maybe you and the school nurse might be the only two people doing that in your school building. And so you really benefit from learning from other schools and other people that are in this situation. Go ahead and keep going. But the collaboration that we had at every level was a show of a commitment that one, immunizations were important, schools were important, and families were important. Certainly, our students were important too. So here's what I was talking about. We did a one-on-one meeting with them at the beginning of the school year, those that accepted the offer, right? And not everybody's going to take you up on the offer, but just don't take it personally and be ready to answer their call at the 11th hour because that also happens. They don't take you up on the offer at the beginning of the school year, but come day before exclusion day, they're like, "Hey, can I get on the phone with you? Hey, hi, can I talk to you tonight at 8 p.m. the night before we have to exclude students?" The answer is yes. I'll happily talk to you. And so that's how we built trust by just being available to them. We were as invested in their success as they were. They were on-call technical assistance, regular updates, monthly community of practice. And then after the state education agency found that some of them hadn't followed the policy, we continued to support those schools through their corrective action process to make sure they understood why they were in corrective action and that they were prepared to provide the data to demonstrate that they were going to be making changes. Keep going, please. So yeah, so what's next? Like I said, the exclusion grades have seen tremendous progress. You saw that in the slide. Overall compliance is slower to rise. Like I said, it continues to rise, and I'm hopeful that once we can get to school year 29-30, that it'll be a lot easier for schools to do this work every year because then every student will have gone through an exclusion grade. Certainly lots of students change schools and they move into DC or they leave DC, but for the most part, those kindergartners 3 years ago are now in first, second grade. So they're not going to hit an exclusion year again until they're in third, fourth, fifth, sixth, seventh. So it's going to take some time to get every student through one of these types of exclusion grades. And so that's 4 more years. But that's okay. It's 4 more years. You can see it. We've done 3 years. We're going to do another four, and then the process should lift a little bit. What's hard is to get any school district to want to do something for 7 years. Uh, or anybody in government, anybody in schools, anybody in a nonprofit. It's just hard for us to commit to something for 7 years. But those of us in public health who work on prevention, you know how important it is to keep your foot on the gas. When you see success, that's when you keep going. Another thing is that we are in DC keeping our eye on measles because we're not naive. We have really high vaccination rates, but there are several grades that are still below herd immunity. And so we are continuing to message that to our families like, hey, now might be a good time to get caught up before we have a significant outbreak. And so that's where you go slow to go fast, right? You want to slow down and really help your families air out their concerns so that you can be a resource or, as they are trying to talk through their own decision-making process. And so one thing that's important to know for healthcare organizations, you all are following CDC's recommendations or the American Academy of Pediatrics recommendations. They are not telling you what to do, they're giving you recommendations. Once you turn to the school level, then you're dealing with laws and policies that are more than recommendations. And so that's really important, especially when we think about vaccine hesitancy. You want to approach families without judgment in either space. But in one space, you're providing them information and recommendations, and you're talking to them about the consequences of not getting the vaccine. But at the school level, the consequences also include not being able to come to school. And because we have this policy and we have to enforce it. So that's also part of when you're talking to families and educating them and answering their questions. You also want to let them know what the consequences are so that they can make the best decision for their kids. If they have to go to work, they may get their questions answered more quickly so that they can get their child vaccinated so their child can stay in school and they don't have to miss school. So and then continuing to think about the funding opportunities. So that is something that I think that is always in flux with when it comes to state and local budgets, that prioritizing resources for immunization support. Again, those of us in public health care a lot more about, we have a lot more tolerance when it comes to prevention work than government officials that like to see fast, immediate progress. So being able to make the case for continuing to support even when progress is made. And I think I want to wrap up. Oh, this is sort of what I was talking to you about. Like this will get us 2930 gets us to the point where every grade has gone through an exclusion grade. Keep going. Oh yeah, I've got 7 steps to success and 5 do's and 1 don't. Let's see if we can get all the way over to those. I've already talked about how families, yeah, this is sort of an example of who all is involved. Sometimes you'll see, I like to do it as a laundry list because then you can like see sort of like the quantity of people. This is more organized in sort of, it's bucketed here. So you can dig around and find yourself in here, but it really takes a lot to get to 100% compliance. It's not just about, well, we just have to hold the parents accountable. Well, that approach does not work with families. They require a lot more engagement. And so where do you fit in this puzzle, and how will you support families in making decisions for their students? Keep going, please. So managing the numbers, being organized, and effective family engagement. That's that relationship building. Keep going. I think I've got and here's the 7 steps to success, and then I'll end with my 5 do's and 1 don't. So if you go back to the 7 keys to immunization success. So these are the 7 that I think are incredibly important when you're working with schools and families to get to success. Use all available resources. None of us have enough of our own things to do anything. We have to work together and use all the resources that are available. And that's one thing I tell schools, like, don't think you have all the answers. Figure out who also has information and can help you. CDC and AAP have great information on vaccines. You don't need to, when a parent asks you a question about a particular vaccine, you don't have to have the answers. You can say, here's a great resource where that can help you learn about the vaccine. Working as a team in your school is part of that. And then I mentioned it earlier. I talk about family engagement a lot, and it's really that consistent, persistent, and creative family engagement. Families need to understand I mean what I mean, right? So that's consistent and it's persistent, and meet all of your family notification deadlines. If your policy says you have to tell families these dates about exclusion, do that. because if you spring it on them, that's not how you build trust, and that's not how you get them to take action. Maybe some, I'll take action if you spring it on me, but not all families will take that action. Uh, Prioritize regular data entry, prioritize regular data tracking. So what you enter takes a few days to show up in what you're tracking because systems, they get uploaded once a day, and you're talking about maybe three systems until it gets to what you're looking at to track. So make sure you're regularly tracking, and then don't forget to share and celebrate the progress and the successes along the way. That's huge. We're all doing a ton of work around immunizations, and if we get celebrated for progress, even if it's not 98% yet, like just celebrate. And then the five do's and one don't, and I'll turn it back over to you. Remain curious and diligent. You don't know what families are going through. You know what you've gone through as maybe the head of your family, or as a provider who works with a lot of families, but you don't know everything that's happening with families. So be curious and diligent. Prepare for parents' questions and pushback. Meet your partners where they are. Meet your families where they are. Fill the knowledge gaps. You have knowledge, you have information, you can share it. It's not just go get this vaccine, but it's, are there questions I can answer? Manage the influx of the immunization documents. We know that our families with Medicaid, that often gets to us electronically, and our families with private insurance are bringing in paper documentation. So make sure you've got a plan to manage that influx, and don't get left in the dark. Don't silo yourself while you do the work because you're gonna come up short. So make sure you're collaborating with those that are there to support you. And I'm going to turn it over to you all.
So I think in the interest of time, we're actually going to be skipping the Menti polls for today. So I'm just going to skip ahead to the engaging families slide for you. You can start there and then kind of have like the wrap up. And then I have just a little bit of like follow through and then we can do questions. So I'll skip to that
Oh,
right here.
okay.
So,
Okay. Well, go ahead. You can do the Menti. This is
okay.
this is fine.
Okay. Let me, I'll reshare then my screen. Let's see.
And really, what I was doing with that engaged families, those are a bunch of strategies. You'll have the slides, so you'll be able to pick and choose those. But there really are some ways in which you can help families remove the barriers that they have. Sometimes you might even need to offer to call the pediatrician yourself. Because families sometimes, they just accept what the pediatrician tells them. And if you can navigate that, or if you can get them enrolled in your school-based health center, so then they can come right to you, and their child can access care even without them. Those are some of the I call them artificial barriers. They're not necessarily artificial because it's somebody else's policy, but it's, like I can only see two children at a time from a family. So then the family gets two of the kids vaccinated and not the third because they can't miss another day of work to be able to take the third kid to the doctor. So that's where you can call and say, we're talking about an immunization only appointment. Just see the three of them. Work with me here. And usually you can use your influence at the school to navigate and remove some of those provider barriers.
All right. So if you haven't already, if you just go to this menti.com, you can also scan that QR code. We just have a few questions here we want to go through just to help kind of boost engagement. I'm going to do a little bit of a wrap up and then we can kind of have a Q&A. So please feel free to type that code at menti.com, that 23887041. Again, that code is 23887041. Menti.com, and you can scan that. And that should still be, it should say like join us at menti.com up here while you're logging into it, but I just want to move us ahead a little bit. So the first question we had was, what support do your families and schools need? And you don't need to overthink this. This is very much just a gut feeling of what support do you think they need? What can you provide? We'd appreciate just hearing any answers. They can be one word, they can just be, they can say trust, or it can be, just a small bit, but what comes to your mind immediately for that. Knowledge, trust, absolutely. But those are big ones. Huge. Yes. Education, trust again. Understanding of health requirements, absolutely, definitely. Truth, provider trust, awareness. Communication is a huge one. That's kind of what, we've all been talking about throughout this presentation. Absolutely. These are really great words to kind of see an overview. Just to discuss. Yep. Consistency, access, absolutely. These are all
Hmm.
key things. Yep. All right. Perfect. Debunking myths. Yep. Kind of going through and clarifying what everyone should know. Encouragement. That's even Johnny, you were just mentioning like
Yeah.
celebrations and keeping that. That's so big. That is so big for people. It means a lot to them. So
Hmm.
we're going to go on to the next slide, which is very related to this. Bear with us. Same presentation. What role can you play in meeting those needs? So in getting that trust and celebrating others, engaging families, what role can you play? We ask you as a member of the audience. It's again, it doesn't have to be overcomplicated. It can be, I'm here for support, or I'm here as a communicator, a listener. Individualized communication, amazing. Absolutely, yes. Coordinating the clinics, knowledge again, meeting them where they are. That's one of my favorite phrases to
Hmm.
say is meet people where they're at, because it's the best way to kind of get that blend of knowledge and understanding. Remaining open-minded, becoming VFC providers, establishing trust,
Yes.
relationships, patience, clarification. These are all amazing, amazing, amazing.
Hmm.
Clarity and coordination. Perfect. Yep, meeting people where they are. Providing opportunities, trust, decreasing those barriers. Absolutely. Please feel free to keep typing those in, but just kind of to move us along, I am going to go
And I want to
ahead.
grab,
Ooh,
can I,
sorry.
if I can jump in real quick.
Sure.
So on the last one, we talked about somebody mentioned vaccines at school, providing vaccines at school. That's an excellent idea. What the biggest barrier to that is parental consent. So really, some best practices are get those consent forms in before the vaccine van shows up, because oftentimes, they'll show up and only like one or two parents have signed their consent form, and then it feels like a lot of resources have been provided for just a couple of vaccines. So if you can coordinate to get those vaccine forms in, the consent forms in advance, that can really help. And working with the community provider that's providing your vaccines, do parents have to be present when you provide the vaccines? If they say yes, then that's a yes. If it's a, well, maybe there, then is there a separate consent form where parents can delegate a responsible adult at the school to be present while the vaccine is provided? So it's two consent forms, the parents consenting to the particular vaccines, and they're consenting to have like the assistant principal there with the child. And so it's that those are some of the best practices to making sure that a vaccine clinic at school can be successful.
Absolutely. So with that, I'm going to go back to the presentation and get ready to close this out. I do want to have an opportunity for questions, but we're kind of short on time today. So I know we tried to integrate those into the actual presentation, but if you have some, maybe we can take one or two. We do have just one closing portion, but I do want to kind of get us back on track with that, and then we'll be able to finish up. All right. So also, I do want to give everyone just like this really quick overview. We talked about a lot today. These slides are in here. You can review them in greater detail, but really it's just going through everything we said: engagement, partnership, building that team. It's teamwork. This is a team effort, a group effort. A system needs to be in place. It's kind of when you create that opportunity for engagement, that's where we see the most success. And Deanna did a fabulous job of kind of going through some ideas for that, and kind of having a school champion is also helpful. I've had teams in other areas say it was great to have like a go-to person. This is the point person. This is who they are. We all kind of know. Getting them and meshing them into like both the school, into the work. It's really great to have that. Family engagement is also super big. It's important to kind of host events to allow families and parents to ask questions, learning about benefits, sharing their concerns, discussing. We already talked about that. Some of you had said like establishing trust, getting those accurate, simple resources, and that outreach needs to be that co-messaging, working with families, working with schools, working with providers. That's how we all kind of can move the work forward. And finally, strong partnership, as we said, it can lead to increased immunization, improved attendance, stronger connections, and better health and academic outcomes. So that's just a little overview of what we're talking about. I encourage you to go back through. We will share the slides and just kind of read through. Here's some of our resources, which we also share. And I think we're out of time right now for the Q&A. So I will invite you to, once we do an email follow-up, if you have any remaining questions, please feel free to send them to us. We can coordinate that with Deanna. We can coordinate that with us. We are happy to answer those, but I just want to make sure that we're respectful of your time when we kind of move on to the end. Um, so I will ask, I said at the beginning that we are an NTAP partner. Part of that means for our funder, we do have a poll that we use that it's a very short one, and I would be interested if you could answer it. It helps us gauge where are we at in the field, what do you need from us? And how can we better support you with the presentations that we give, the content we give? So please keep filling that out. And I'm going to go through those last few slides and then I'll close us out for today. All right. Yeah. So if you haven't already, please you can go see on our website. We're going to have our conference this year. It will be in DC. Registration is open. We'd love to see all of you. It's a great time for networking. It's a great opportunity to see people in person. I love when people come up to me and be like, "Hey, you're Donnie. I know you." It's a really great time to kind of see each other. This is a topic we can discuss. Lots of opportunities. So I welcome you to go on our website and register. And please feel free to stay connected with us. We do have all of our social media. I will happily share all of Deanna's information so you can have work with her. We are so appreciative of all of you attending today, and we are so appreciative of you, Deanna, for being here, imparting your wisdom, giving us that was great. I love this topic because it's a really way to highlight engagement and working with others and being together, and it's something that I appreciate. So thank you so much for being here, and thank you to the rest of you. And I will say you can
Sure.
have a great day, right on the dot. And if you had any questions, I'll happily coordinate that with you. Thank you so much, everyone. Have a
Thank
great day.
you.